Hi, I'm Dr. Mangesh Kamath. I'm a senior consultant, medical oncologist, hemato-oncologist, and bone marrow transplant physician practicing at Helios Cancer Hematology Clinics, Bengaluru. So, topic that I'm going to discuss now is on liver cancer. Liver cancer is considered to be one of the most aggressive cancers known to medical oncologists. It is a very difficult to treat cancer, and most of the time liver cancer comes to us in an advanced stage. It is not very common to discover or diagnose liver cancer at the earliest stage because symptoms are not very common in the early stages. So, when it comes to treatment of liver cancer, from an oncologist point of view, we have only two categories. There are multiple stages, multiple classifications, but when it comes to an oncologist, and from my perspective, I would like to call liver cancer into two major stages. One is an curable stage, wherein the cancer is in the liver, either through surgery or any other means. Along with surgery, we are able to completely remove the tumor from the liver, and then we can do whatever treatment we want after the surgery, but the tumor is completely removed from the body, and that I would like to call it as the curable stage. Second is an incurable stage or an advanced stage where you are looking at reducing the symptoms for the patient and prolonging the life of the patient. This is the two major stages. Now, why does liver cancer occur? Liver cancer can occur due to a chronically damaged liver. That means a liver that has been damaged due to some or the other insult in the body. For example, an alcoholic who has damaged his liver due to long-term alcohol abuse. 2. Due to long-term obesity, which has caused fatty liver, and that fatty liver has then worsened and again destroyed the liver to cause chronic liver disease. Infections with viruses such as hepatitis B, hepatitis C. And sometimes we actually do not know what has damaged the liver. There could be something, but it was not discovered all these years. Patient presents with the tumor and then you find out that the liver is damaged. So, these are many of the causes. I will not go into too many causes because it's difficult to discuss each of them. But in general, there is something that has damaged the liver, and due to that chronic ongoing damage to the liver, tumor cells develop from the liver cells, and that's how you get liver tumors. Now, it is very uncommon to get symptoms which are specific to liver tumor because already the patient is undergoing lot of issues because of the chronic damage to the liver. I'll give an example. For example, an alcoholic who's been drinking heavily and his liver has been damaged due to chronic alcohol abuse. Already there is a lot of symptoms such as loss of appetite, the patient is losing weight, there are a lot of vague and specific symptoms such as loss of muscle mass, body aches, inability to sleep well, tremors in the hands, and so on and so forth. So it is very difficult for the patient, when he is already undergoing these symptoms, to actually then develop new specific symptoms which will tell that patient has liver tumor. Jaundice is not very common immediately in liver tumors. Sometimes patients with liver tumors may not have too much jaundice to speak of. Sometimes patient may come with a bloated abdomen, which could be because of accumulation of water. That condition is called as ascites. Again, ascites can also occur because of chronic liver damage, and it may not be directly because of just the liver tumor. So, it is difficult to symptomatically diagnose liver tumors. But whenever we feel that a patient is having some symptoms because of liver disease, then we go ahead and do an ultrasound of the abdomen and ultrasound, and if required, a triple phase contrast CT scan, and find out that the patient has a liver tumor or not. Once we see radiologically that the patient has liver tumor, the next thing we do is we measure a tumor marker called as serum alpha fetoprotein, which is a marker for liver tumors in general. If the serum alpha fetoprotein is very high, then we may not even do the biopsy of the tumor and diagnose. Sometimes it is just enough that the high alpha fetoprotein indicates that the patient has liver tumor. Some cases we may do a liver biopsy. So how do you go about treating liver cancer? As I said, if the liver cancer has come in the earliest stage, which is confined to the liver without many of the other factors which have destroyed the liver, we may consider a liver transplantation. It is a very complex procedure, can be expensive as well. So, expert or a skillful and experienced liver transplant surgeon will consult the patient and recommend if liver transplant will help the patient or not. If the tumor is very small, then we do liver tumor resection, which is also possible, and patients are actually lucky if they have a very small tumor discovered at diagnosis and they can undergo the liver resection. And if at all it is borderline resectable, that means not immediately resectable, sometimes we employ certain strategies such as giving chemotherapy through the artery which supplies the liver, by which we can destroy the area of the liver which is containing a tumor and help the normal liver grow normally, and thereafter do a surgery which will help remove the damaged liver along with the tumor. So these are some strategies that I found. We can talk extremely technical about it, but you may not understand everything. But make sure when you have a patient who has liver tumor, he is seen by a multidisciplinary team such as the liver transplant surgeon, medical oncologist, radiation oncologist, nuclear medicine specialist, all of them together along with the pathologist, radiologist and all the other colleagues in the management of cancer, so that the liver tumor can be treated in the best way. If the liver tumor is advanced, which is not resectable, patient's condition is too bad for patient to undergo a liver surgery, and many other factors which does not allow the patient to undergo surgery, in this condition, the best way is to give certain medications, and these are not chemotherapy, remember that. So, give certain medications by which we can help the patient to live with the cancer for as long as possible with the least symptom as possible. So, the two major modalities we employ, medical oncologists employ for the management of advanced liver tumor is: one is to give certain tablets called as tyrosine kinase inhibitors. They help in reducing the blood supply to the tumor, due to which the tumor cells do not derive blood supply much and the tumor cell growth is controlled. Another strategy which has become very popular now is to give immunotherapy. Immunotherapy is a strategy wherein you give certain medications by which all the immune cells of the body are recruited at the site of the liver tumor, and these immunity cells will then fight against the liver tumor cells and help to control the tumor. There are multiple other strategies. If you have a liver tumor which is giving a lot of symptoms, you can even employ radiotherapy. You can employ, as I told you, strategies such as transarterial chemoembolization, wherein you give chemotherapy through the arteries of the liver, and that goes and blocks the blood supply to the liver tumor and helps shrinks it. These are multiple strategies that are available. You can also do what is called as radiofrequency ablation to the small liver tumors if they come in the earlier stage. I am just mentioning some of them. They may not be extremely of great utility for every patient, but depending on the various clinical scenarios, we do employ them. Now, after all these strategies, how curable is liver cancer? It is not extremely curable, to be honest. If the patient can undergo a completely resectable surgery wherein the entire tumor is removable, then cure rates are very high, can be as high as 60% in some cases. But if they are in advanced stages, the cure rate is less than 10 to 15%, and which is why there is a lot of research happening in the field of liver cancer. And as time goes on, like many other cancers that we know, you will hear of much more potent treatment approaches for liver cancer. So friends, while we have discussed about liver cancer, prevention is definitely better than treatment in the case of liver cancer. So if you are an alcoholic, if you are obese, try to deal with these issues, because these two issues can definitely be addressed and you can prevent a large number of liver cancer. And get yourself vaccinated against hepatitis B, and follow safe sex practices, and make sure that if you have any liver problem, whatever the cause may be, get evaluated by a hepatologist or gastroenterologist, so that your liver disease can be controlled at the earliest phase, and liver cancer to a large extent can be prevented. Thank you very much.